I'm just doing so well, and I'm feeling so good, and thank you.
Wow.
Thank you.
That's
Yes.
great, yeah. Well, what did you think when your doctor suggested, you know, the actual physical therapist? Did you think the doctor was kind of not caring, or, you know, not really concerning
No.
himself with your problem, or?
No, I think that he really did care, and by suggesting that I see Jan, he was really trying to offer me a piece of health that I wasn't able to get from anybody else, and it truly is exactly that.
Wow, that is amazing.
Yeah, it is.
Wow.
It is.
And now look at you. And you look so vibrant when you walked in the door, and
Oh, thank
that's
you.
so great. Yeah.
Yes, it is very. Well, I have a new lease on life.
Oh yeah.
I really do. I have a new lease on life, and it's just so nice to be able to go for it again.
Yeah. It's pretty scary what you were going through. Sitting
Very.
in a rocking chair for how many hours a day?
Yeah, just all day. All day I would be there. So, yes, it is much. It's so good to be on track again.
So what would you say to our viewers? What would you recommend?
Oh, don't let somebody tell you that it can't change. You have to be brave enough to take a chance, because I think that's what I did, was take a chance on Jan.
Well, you
and
really,
I would.
Did you have anything to lose, though?
No, I did not.
Yeah.
I had nothing to lose, and so giving myself permission to trust another person, that was big. That was big.
Because you've been let down so many times.
Yeah.
Oh my gosh, how many doctors did you see?
Oh, I've seen probably 4. With no results. I mean, another medication, try another medication, try another medication. Well, they just didn't help. They didn't help. So I am just a fan of Jan. I am a fan.
Well, thank you.
It worked
Wow,
absolutely.
that's great. So it was a win-win situation in for you,
Yeah,
too.
it was. But
Yeah.
because I'm in this business, because I enjoy seeing people feel better. And so that's really exciting for me too, you know. But I think, Joan, I'm sort of curious too, you know, because a lot of viewers might identify with, well, I've tried physical therapy. So, you know, one of the things that's really important to understand is that physical therapy can be very different from clinic to clinic, based on the specialty of that clinic and the staff that are there and what they've studied after they got out of physical therapy school. Because that sort of identifies more what kind of treatment techniques they will use when they're treating patients. So you can't just look in a phone book and pick up, see a number and call somebody and expect to get the same kind of treatment. In the United States, there are probably across the United States maybe 1,000 people that are trained in one of the techniques I use, which is PRRT.
So that basically
is primal reflex release technique.
And that's something that you yourself are qualified in doing that other physical therapists aren't. So that's kind of a little different treatment that you do, right?
It's a different treatment technique, which I have found to really help people with painful conditions. And it was developed by John Iams in California, who is a physical therapist. A couple of years ago, there were only about 125 to 150 therapists with advanced training, which is what I have. There may be a lot of therapists in the U.S. that have basic training, but it would be important probably to look for a therapist who has at least intermediate training. But if there isn't anybody in the area of the country, then try anybody that has the technique that they've been using. And the other technique that I use is ETPS, which is an electrical stimulation device that is used on acupuncture points, and that has really helped treat my patients with chronic fatigue, as well as all the patients that I have also with pain. So when I treat patients, I use a whole gamut of types of techniques that I've used over the years. I use traditional techniques as well as these newer techniques, which are not really non-traditional. They are just emerging practice right now.
It's sort of like acupuncture. You know, that's really pretty old, but yet at the same time, it's coming back because people are choosing to try it, and it's actually succeeding, you know, with them. So I was just curious now, you know, in knowing you say, you know, this type of treatment, what made you pursue to get educated and to get a license in these other fields too, along top with being a physical therapist?
Well, I'm really only licensed as a physical therapist, but these other techniques interested me because there are some problems that we see in physical therapy that traditional physical therapy techniques, in my opinion, don't help as much. And those are some of the problems like migraine or fibromyalgia. So I had just heard from other therapists that had used these techniques and were getting better success using them with certain types of patients. And decided that I wanted to explore that more. So that's what got me interested. And the more I used it in conjunction with everything else I knew, the better effectiveness I had with my patients. And that was really exciting because I've had some patients come to me with headaches that they've had for 30 or 35 years, you know, and we're able to get them under control. Now, these techniques may not take everything away, may not take all the pain away, but at least they give people a functional life back for most people. Most people.
Because to be in chronic pain every day like you were, and to be able to go from, you know, a small headache, from a, you know, migraine to a smaller headache, at least then you can go ahead and enjoy parts of your life.
Or, you know, at least find that you can sleep again.
And then
or you can go somewhere and stand for a while, you know, and watch something. Or you can go to a game and sit unsupported. And so I think using these treatment techniques, as I've said, has really made a remarkable change in the effectiveness in the effectiveness I get with my patients. And the other thing is that in our clinic we also use a little different model. So we start with getting the pain reduced first and getting the person's body structurally sound and getting core stability there first before we move on to exercise, which is very different than a lot of clinics which may start with exercise or may not include some of these other techniques.
And what a great asset to, you know, give Joan back her quality of life and to make it so much more beneficial. You know, the thing is, you know, you, of course, using these new techniques, and you're seeing the statistics of improvement are really, really good. So that in itself is a reward, let alone your testimony here with Joan. Yeah, that must be a really good feeling.
It's really a good feeling to see people, hear from people and say, I'm really, really doing great.
You're kind of their little hero.
They're mine too, because they have to do what I ask them to do.
That's good. That's really nice. So I guess a lot of people are probably, you know, looking, oh, I'm in that boat. I'm, you know, there. I've been doing this for so long. So what makes a person a perfect candidate for treatment then?
You know, I never really know how anybody's going to respond until they get to my clinic and I try the treatments on them. So the most I can say is if they want to try to change, then they need to try. And the nice thing about the PRRT, primal